The American Heart Association Resuscitation Quality Improvement Program emphasizes skills mastery through low-dose, high-frequency training and performance feedback. The AHA has now created RQI Pediatric Advanced Life Support, or RQI PALS, to help train healthcare providers to recognize and address cardiopulmonary emergencies in pediatric patients. To learn to effectively treat pediatric patients, learners interact with real patient cases presented in realistic e-simulations and animations to assess and treat patients in virtual healthcare settings. To begin, students must complete the pre-course self-assessment, which will evaluate the learner's ability to integrate both rhythm interpretation and use of pharmacologic agents. For some, this will be a review. Others will learn that more preparation is needed before beginning the course. The cognitive portion includes critical learning modules, which are spread throughout the 2-year curriculum. Topics covered in these modules include team dynamics, hypovolemic shock, and upper-lower airway obstruction, among others. These topics feature several videos presenting the latest PALS science updates and recommendations from the American Heart Association. Using realistic patient cases, learners apply their knowledge to real-time decision-making. The patient cases reinforce the important concepts of a systematic approach to pediatric assessment, basic life support, PALS treatment algorithms, effective resuscitation, and team dynamics. The tutorial leading into the patient cases will teach how to direct the healthcare providers during the simulation. Viewing the tutorial will help learners to complete the patient cases. In all patient cases, the student is the team leader and will direct the healthcare provider's actions to assess and treat patients in the hospital. After successfully completing all the patient cases, learners will take a multiple-choice exam. Along with the cognitive modules, the RQI PALS program consists of quarterly scheduled psychomotor skills activities that provide students with audio-visual directive feedback on their performance in the areas of compressions, ventilations, and 2 rescuer CPR for infant and child. Throughout the RQI PALS program, the student has access to the latest PALS provider manual, the 2015 AHA Guidelines Update for Cardiopulmonary Resuscitation and Emergency Cardiovascular Care, and the 2015 Handbook of Emergency Cardiovascular Care for Healthcare Providers. The combination of cognitive learning and psychomotor skills practice in the RQI PALS course improves providers' confidence and skill levels for delivering effective emergency pediatric care.